Hi there, my name is Tracey and thank you for clicking on this video. If you have clicked on this video to learn how to perform manual lymphatic drainage on the legs, clicked on the suggested video or the suggested link in the corner. If you all would like to stick around to learn what exactly a dermal clinician is and what purpose they serve in the healthcare system, as well as the in-depth information to what the lymphatic system is, please stick around and continue watching. Dermal clinicians are an affiliated member of the Allied Health Professions in Australia. We specialise in skin management and non-surgical treatments to assist with acute and chronic skin conditions, disorders and diseases. The educational of dermal health professionals is broad with a 4-year bachelor degree. It includes study in skin, wound biology, dermatologic conditions and management with the goal to improve the quality of life of those affected. And that is by procedures best advocated through evidence-based research. Conversely, skin health and problems is associated with many other disorders and diseases. Dermal clinicians will have a focus and passion on public health, skin health education, and prevention programs. Most importantly, we assess and manage risks associated with tissue interactions and advanced therapies to ensure treatments are effective and safe for consumers. The lymphatic system helps maintain homeostasis within the body during times of inflammation. It removes waste, carries lipids and proteins throughout the body, essentially helping manage fluid and fighting infection to aid in wound repair and healing. As you can see in the video, lymph vessels cover the entire body with 400 to 700 lymph nodes, mainly in the trunk of the body. The lymphatic system is a linear network that runs parallel to the venous system in your body, so basically everywhere except behind your cornea. There is a superficial and a deep. Superficial runs more on the skin and the subcutaneous layer, whereas deep continues to where your organs are to the heart. Before the fluid reaches the heart, it is detoxified by lymph nodes around your body. Lymph fluid moves by skeletal muscle movement, therefore things like walking, massage, breathing can all influence lymph movement. Therefore, being besides the venous network, when the heart pumps, the venous movement moves, therefore anchoring filaments allow the lymphatic system to draw interstitial fluid in. Any type of swelling in the body involves the lymphatic system. This occurs when the lymphatic system is interrupted and there is a fluid buildup in the section of the body exceeding the capacity of the blood and the lymphatic vasculature. This can occur when you are stagnant for too long or when you incur an injury. Acute edema, which can occur from 3 days to 3 weeks, is when inflammation occurs as a reaction of trauma or abnormalities in your body. The reaction is to prevent infection from spreading. Chronic edema can persist for more than 3 months. It is usually multifactorial, which can involve either systemic diseases, medications, and lifestyle factors. Lymphedema can occur when there is trauma or an infection to the area of the body where your lymph nodes and vessels are not working properly. Therefore, the ability to prevent constant inflammation and protein-rich fluid buildup in the area is compromised, and therefore ongoing management and treatment will be needed. Manual lymphatic drainage is a form of superficial light massage that increases the flow of lymph fluid in areas where it is built up to more viable areas within the body. Manual lymphatic drainage is great for reducing inflammation. On the side of the screen are listed conditions where manual lymphatic drainage may assist in. People with the following conditions listed on the side of the screen are contraindicated for manual lymphatic drainage, and we do not recommend the treatment to be performed unless you are cleared by the doctor. Before we begin, it is important that you know the principles of manual lymphatic drainage. 1 is identifying where the lymph nodes and the watersheds are. As you can see on this lymphatic drainage map, in the key, it displays the lymph nodes, the flow of drainage, and the watershed. It might be useful to have this printed out beside you while you are performing. All these maps are in the description box below. Two, direction of flow. Remember to always work towards the lymph nodes. 3. Pressure should be light to superficial. There should be no positive pressure when working on the skin. Should be only slight tugging on the skin, but no positive pressure at all. 4. You should always work proximal to distal. So remember, you got to empty the lymph nodes first before you refill them. so always working from closer to the lymph nodes than further away. Manual lymphatic drainage for the legs may be suitable for people who lack adequate access to professional help due to location and decreased mobility. Especially during this time and day, it is good to have it in the comfort of your own home. It can also be time efficient and perhaps cost effective. Remember, when you're working on the lymph nodes, you may apply more positive pressure as they are deeper in the body in comparison to the lymphatic vessels. For the legs, you will be working with the axillary node, the inguinal node, and the popliteal node. Remember to print the map out that I have put in the description box below just to help you with remembering the flow of drainage, where the lymph nodes are and where the watersheds are. For the purpose of this demonstration, my patient does have clothes on, but it is better for your patient to have skin-to-skin contact with your hands. Let's begin. Start by asking your patient to take big deep breaths in and out, and on their breath out, you apply pressure on their stomach as well as their chest, as you can see in the video. Your next step is to empty the axillary nodes. Remember, at the nodes, you're allowed to apply more pressure. Next, you'll be bringing the lymph fluid across the substitution path, also known as anastomosis, across the body towards the axillary node. Remember, anastomosis will allow lymph fluid to pass through watersheds. And also remember, here superficial to light pressure only and working proximal to distal, so start closer to the lymph node and then work further away. Here you can also work on the axillary lymph node if your patient has a lot of edema in this area of the body. And next, you'll be working on the inguinal nodes. Again, remember, at the lymph nodes you may apply more pressure. So next, we are working on the upper thigh and under the thigh. For both of these areas, you'll be working towards the inguinal nodes. So having your map on the side of you will definitely help in knowing where the watersheds are and your direction of flow and drainage. Making sure you're always doing superficial to light pressure and working proximal to distal. So starting off closer to the lymph node and then working further away. You might even want to do some effleurage movements to help the fluid move, and it might be a lot more relaxing for your patient as well. For some patients with major edema here, you might want to go back to the inguinal node and do some massage there to allow for the inguinal nodes to empty. Next, you'll be working on the popliteal nodes. This is right behind your knee, and remember, at the lymph nodes you may apply more pressure. After that, you may work on the upper calf. Here, you'll be bringing the fluids towards the inguinal nodes. After that, you may work on the under the calf, and with under the calf, you are bringing the fluid towards the popliteal nodes. Again, remember, here you are doing superficial to light pressure and always working proximal to distal. You may do some effleurage movements as well to help with the fluid movement. And also having, again, the map on the side to know where the watersheds are may also be helpful for you. And the next step is to work on the feet. For the upper side of the feet, you'll have to bring the fluids towards the inguinal nodes and popliteal nodes. For fluid under the feet, you'll have to scoop it up towards the upper side of the feet and then move it towards the inguinal and popliteal nodes. For my patient, she did have edema on her feet, therefore I did repeat this motion quite a bit. Once you have finished this, due to the lymphatic system being a linear network, you will then go backwards from step 11 back to 1 to empty all the lymph nodes and also bring back fluid to the center of the body that has been detoxified. And remember, again, superficial to light, proximal to distal, and it doesn't matter the sequence that you do, as long as you're following all the principles, then you should be okay. There is no rule or no distinct pattern to go and follow towards, but as long as you're following the 4 principles and remembering to empty the lymph nodes, you're doing just fine. Now this is a picture of my patient post-treatment on only her right leg. Can you guys see this difference in the sizes of her feet and her ankle? Absolutely amazing. Immediately after your treatment, you may have a mild headache, feel tired, or need to go to the toilet more often. In the next 24 hours, we recommend exercise lightly, drink lots of water, refrain from coffee, alcohol, and cigarettes, and only using gentle skincare. Thank you for watching. We hope you enjoyed. If you have any questions or any inquiries, or if you want to request for lymphatic drainage on the arm or the face, just put it in the comments below. Just remember to subscribe, and if you want to continue watching the video demonstration again, just click here. Thank you for watching. See you next time.